Welcome, curious minds, to List of, the channel where we count down the weird, the wonderful, and the downright terrifying. Today, we're diving into the annals of medical history to uncover some of the strangest treatments ever tried on a human body. Grab your lab coat, or maybe just a sense of humor, because what we're about to explore makes modern medicine look like a gentle massage. 1. Bloodletting, the original take one for the team approach. From ancient Egypt to 19th century Europe, doctors believed that many illnesses were caused by an excess of bad blood. The solution? Cut open a vein, let the crimson flow, and hope the patient doesn't turn into a vampire. The practice persisted for over 2,000 years, championed by the likes of Hippocrates and Galen. Imagine a modern ER triage. Sir, you have a fever. We'll just open up your femoral artery and see if the fever runs away. 2. Trepanation, literally drilling a hole in the head. The earliest skulls showing trepanation date back to the Neolithic period, and in some cases the patients survived, as evidenced by bone regrowth. It was thought to release evil spirits, relieve head trauma, or simply let the mind breathe. If you ever hear someone say, "I need a little headspace," they probably weren't thinking about a literal skull-bored window. 3. Lobotomy, the 20th century answer to a wide range of mental illnesses, from depression to being too creative. Portuguese neurologist Antonio Egas Moniz invented the procedure in the 1930s, earning a Nobel Prize for cutting down mental anguish. The operation involved inserting an ice-cold metal instrument, the leucodome, into the brain to sever connections in the prefrontal cortex. Nowadays, we'd call that a very aggressive form of resetting your router. Except the router is your personality. 4. Mercury treatments, because nothing says cure like a heavy metal that also poisons you. From the 16th to the 19th centuries, physicians prescribed mercury for everything: syphilis, constipation, and even the common cold. Mercury's bright silvery allure convinced many that it must be a miracle element. In reality, patients often ended up with tremors, gum discoloration, and the infamous Mad Hatter syndrome. If you ever feel like your hat is getting a little shiny, it might just be mercury trying to win an Oscar for Best Supporting Toxicity. 5. Leech therapy, the original biofeedback device. Leeches were placed on patients to suck away bad blood and excess humors. By the 19th century, a single leech could cost a gold coin, making them the original luxury spa treatment. Leeches do release an anticoagulant called hirudin, which actually has modern medical applications, like preventing clotting after microsurgery. So, next time you're at a spa, remember you could be paying for a tiny, blood-sucking therapist who's basically the world's most committed blood donor. 6. Tobacco smoke enemas, because inhaling smoke is for the lungs. But the colon? Apparently, yes. In the 18th century Europe, physicians believed that the spirit of tobacco could stimulate the bowels, cure headaches, and even revive the dead. The practice involved blowing tobacco smoke into a patient's rectum using a bellows-like contraption. If you ever wonder why your great-grandfather's diary mentions a puff of the pipe in the back garden, he might have been describing a very smoky bathroom break. 7. Radium cures, the glowing cure-all of the early 20th century. After Marie Curie's discovery of radium in 1898, enterprising quack companies marketed radium water, radium toothpaste, and even radiant cosmetics. Radium emits alpha particles that can destroy cancer cells, but the dosage matters. In the 1920s, people were literally glowing, a side effect of radiation poisoning. Imagine a modern influencer boasting, "I'm lit from the inside out." They'd probably be talking about a faulty phone charger, not radium toothpaste. 8. Animal dung poultices, because when you can't find a sterile dressing, you'll improvise with whatever's on hand. In medieval Europe and parts of Asia, fresh animal excrement was applied to wounds, burns, and even broken bones, believed to draw out infection. The logic was that the warm, moist environment would promote healing, but in practice, it introduced countless bacteria. If you ever think your roommate's cooking smells earthy, just remember that historically, that was considered a medical aroma. So what ties these bizarre practices together? A blend of limited scientific knowledge, the earnest desire to help, and a sprinkle of humankind's uncanny ability to trust the latest miracle cure, no matter how unusual. The good news? modern medicine has largely left these oddities behind, thanks to evidence-based research, clinical trials, and the occasional skeptical voice shouting, "Wait, that's a bad idea!" But the stories remain, reminding us that the path to progress is paved with leeches, lances, and luminous toothpaste. If you enjoyed this quick tour through the darker and occasionally dank corners of medical history, give us a thumbs up, subscribe, and smash that notification bell so you never miss another weird but true countdown. Got a strange historical remedy you want us to investigate? Drop it in the comments below. Thanks for watching List of. Stay curious, stay healthy, and remember, the only thing you should be bleeding is your favorite playlist. See you next time!